Thank you very much, Uncle.
Let me quickly say that we may or may not have the Minister of Information joining us, but we go ahead with Dr. Fala and Dr. Jala. Where are we now? I followed the update from yesterday, and the backlash is that, the family member of the only dead victim as of yet is saying that this man did not die of COVID-19. Where are we? Let me begin with Dr. Jala.
Well, first of all, let's say good afternoon to all and happy Palm Sunday. Let's start with that. And we thank the churches, those who are praying within their houses and within their little group or online. We want to say thank you for your continuous prayer for the nation and for all of the people around the world that have either lost their lives, their family members, or are currently sick themselves. We want to say thank you for your continuous prayer for Mama Liberia. Now, yesterday, I think there was a mix-up when they called the names because I said something else and something else was announced. The person name that was the person I advertised, even though we said a 72-year-old male, but we called the name. When we called the name, I don't see which family was arguing over which name that was called. Okay? The name was John Ye, Y-E-A-H. This was the name that Eugene called. So which family is putting news out there? We don't even know. Is it another family? Because a couple of persons died at ELWA. So maybe the first family just heard a 72-year-old and they assumed maybe that was their relative, and then they started putting news on Facebook and other places. But to clarify, according to the name that I received, it was John Ye who died in ELWA. And maybe other people died there. So if it's your relatives, we say we extend our deepest sympathy to your family. We did not mean to cause any or hardship or harm to any family. We just need to get the word out there so we can start the contact tracing for the benefit of your family.
Okay, so before we proceed, let me say that this presentation is being carried on LNTV Liberia Live. That's our Facebook page. You can follow us on LNTV as well as live on ELBC Radio. It's also carried live on Spoon TV and Spoon FM, also on Punch TV, and it's also being relayed, I understand, by Radio G in Fishtown and Voice of Hope in Plebo, Maryland County. Now, as we proceed, let me come to Dr. Fala now. Dr. Fala, where are we? Are we still at the number we had yesterday in terms of 10 cases? Especially now with one death.
The minister to address that, then I can come look at the technical aspect.
Okay. So again, I hate to be the bearer of bad news, but as of last night, this morning, the number of cases have increased from 10 to 13. Just to be clear, it went from 10 to 13. Now, other than 3 new cases, 2 of them were people that were presenting with these symptoms, and by the time we were called, they are already died. So 2 of the victims are already dead. It's a male and a female, and they are already dead. When we tested them, they tested positive. Only 1 of the individuals are still alive, and she had been transported to the treatment center as of this morning. So 13 cases. Now you can say 3 deaths. Yep. So the 3 deaths, all 3 of those deaths from before, we did not get to treat the patient in our treatment center. They died outside of our treatment center, either at home or in another hospital. And we are taking the precautionary measures with those hospitals to make sure that the places are sprayed and those who were in contact are being identified and followed.
The next question I'd like to ask is, these people who died and the 1 person that's alive of the 3 new cases, is there any information as to how they got the virus?
So that's the EpiLink. So of the 3 new cases, 1 for sure we have the EpiLink. It's a healthcare worker where case number 6 went for treatment. Yeah, and so always there are 2 major areas that are high risk zone in this disease. It's in healthcare facilities and it's at home among close families. So we know of that case. The other one is a home death. So what we're going to do is a foreign national of countries at the time that were not on our list that were taken to quarantine. So we had countries, if you had 200 cases, so they came in. What our team strive to do today is to find what we call the epi-link. Is that case linked to a case?
Okay.
So most of our cases that we've had have an epi-link, except they are individual. We know that this is the source of infection. And so once you see a case that does not have a source of infection, you must be able to investigate, or else you think that you're having a community transmission. And if you have a community transmission, then you have to work hard to make people to intensify their social distancing. So by this evening, since last night, the team has been working to ask the deep questions. What is the route? How did this person travel? Is this person connected to any of our known cases? If this person is not connected to any of our known cases, are there unknown spread around that we need to find? That's what you're going to see happening in a couple of days. And the issue of the hospital I want to speak to is that the hospital have what we call a case definition. Before we can even draw blood from a health facility, there must be presenting symptoms that will raise a suspicion of the healthcare workers to call us, like the case that passed away at Elwa. He had fever, high fever, and respiratory distress that had to be put on oxygen. And coughing, fever, respiratory distress are the cardinal sign for a typical suspect case. It was on the basis of that we were called. By the time we got there, the patient on oxygen, but we said because they fulfill this requirement, it is our obligation to test everybody to rule out whether they are positive or negative.
Now, Dr. Jala, yesterday you talked about having sufficient test kits in the country as of now. What I'm going to ask now is, how do we get our health facilities in the hot zones like Montserrat and Margibi counties to probably have access to these kits, so whenever people come, they test them before they start to treat them, they can be tested, and then the results can come in, so you can catch these cases early.
Well, one thing we can say, remember this disease is highly infectious. So can you imagine if every hospital has it, you will be infecting or healthcare workers all over the place. So right now we want to control the tests.
Okay.
While we begin to train healthcare workers, especially lab workers, to be able to take specific tests, and each one of those facilities have to have an isolation area organized to put the patient there so that nobody else is infected. So these things have to be organized. You can't just give everybody a test kit. It's not regular malaria or typhoid that everybody will be testing. You can see that we have some facilities that have labs, and these lab technicians in these facilities are experienced lab technicians, and they have gotten infected. So we need to go back and say, for example, if we're going to put the test in GFK, we have to make sure GFK have an isolation unit and or special lab technicians that will be trained specifically to collect COVID-19 specimen. And these things that we are working on, we're hoping that once the rapid tests get in the country, then we'll be able to train the specific people, and that will help to catch those who have the disease, but also prevent the spread to healthcare workers.
Correct me if I'm wrong. So that means we have 2 foreign nationals who've died from COVID in Liberia.
No, it can be 2. We have one of them is not dead.
Okay.
He's at a treatment center.
Okay.
It's the second one right here.
The second person died. So
Yeah.
that's 1 death.
Yeah, one foreign national death.
Okay, so far. All right. Now let's talk a bit about the new case. There are 3 and 2 have died. So the person that's alive. Any information as to which community? I know you want to be careful too. Stigmatization is also there, but which community, so people can be aware. Where these cases are germinating from.
I don't know if we want to call the community. Let's stick to our investigation.
Okay.
Because we want to find the linkages, because people will fear and there might be reaction. We know there have been instances where they were trying to burn people's houses. But one of them is a healthcare worker, and that probably tended to case number 6, and I had the contact how much we know, because case number 6 went to the hospital. To this particular one of 5 hospitals you went to. This is case number 6 that we visited the hospital, and a female got infected. Yes. And let us continue to dig deep and get more information. Otherwise, we might have a panic reaction saying that we just got a result less than 12 hours ago. Let's continue to do we got to dig deep. And that is also built on trust to realize the linkages, and that will allow us to find contacts.
And one new thing that we have instituted, before we come to say anything on the air, we make sure that the individual and or the hospital that reported the case and the individual families know that the patient were tested positive before we come out to say that. We also don't want to create more panic in the communities, because then the victim's family will begin to run away. And then we have to, so by the time you hear your relative, instead of coming to us, you will be trying to head for next county, then you go on and we can't find you. So let us do our thorough investigation, contact all the families, contact all the contacts of the individual, then eventually we can come to where we can see the community.
So that means we have this health worker. Is it the first health worker to get the virus?
No, yesterday there were 2 health workers among the 3 cases yesterday.
Okay.
And so that's, like I said, that just tells you the risks involved for health workers. The training has been going on, and the need for health workers to really, at this time, create overall high suspicion. It is now unique to Liberia. In China, actually, the first hospital that the coronavirus was discovered, 41% of all the healthcare workers became infected. So there are 2 main cluster institutions that happen within families and within health institutions. So yeah, and the other thing we pick up with the disease is that corona is a disease of the rich, the VIP, and the elite. And so even if you look at our data, most of the people that are infected go to these very rich hospitals. So we are now working and targeting those ones first, and then come and target the rest of the hospital. All around the world, it is the prince and princesses around the world that are affected, the millionaire, the basketball star. And so obviously the predisposition, health-seeking behavior of these people is to go to high-level private hospitals. And all our data we're seeing is sort of reflect what it's seeing all over the country. So that means we've got to work a little bit harder preparing the hospital so that it can create a high index of suspicion, like the minister said, to always have a triage. You rather keep that person outside than to introduce him to the hospital, because then you risk increasing the infection.
Social distancing is something, and I heard the minister say yesterday that we don't want to reach a point where we start to force people or beat people rotten just to keep them home. But people seem to be still moving about, and some people still are not observing these measures as much as we watch the international news network, and it's scary, to say the least.
Well, you know, there's always doubting Thomas. And once you are doubting Thomas, you must see to believe. And we have a lot of Liberians. Some of them are very vulnerable. Some people are very gullible. They just listen to anything. So if somebody can't tell you, say, corona is not real, even though you've seen it in New York, there's nobody walking around in New York. There's nobody walking around anywhere. But you still won't believe. So we're hoping that as time go on, you can see that we started with 3, now we are 13. The more you are out there, the more your chances, because now it's coming in some communities. So you have to now watch yourself, because you can't see the corona coming to you. Corona is not dressed in any outfit that coming to show themselves. So you have to be very careful. And we can only appeal to our fellow Liberian people to join this fight, instead of standing on the outside looking in and waiting. We noticed one thing. Let me just go off a little bit. We noticed one thing, that all of a sudden there's an increased number of dead bodies all over the place. They keep calling us, there's somebody there. So that tells us that people are listening, because they are afraid of their own dead bodies right now. So we are currently trying to come up with some SOPs, because it's not like Ebola. So we're trying to come up with some system that people can follow, because everybody want you to come to the house or to come pick up somebody that have died. So we want to come up with that so that people can begin to follow the regulations instead of running away from the body, because we might not have that kind of manpower to come to every neighborhood when somebody died.
How are we fast tracking the training of lab technicians and healthcare workers, especially who will be at the different triages to be able to man cases when they come in, if and when they are tested positive or they showing signs and symptoms of COVID?
So I think that what the team has done, working along with the private health sector, is that they identified the 300 health facilities. They've done national TOT. They trained the first 135 healthcare worker, and now what's going to happen now is the surveillance focal persons. The target is that a clinic will have 2 surveillance focal persons, a health center 3, and a hospital 4. That's about 1,000 persons that needs to be trained. The balancing act is how do we train these people who got to do social distancing. So the private health sector are trying to do the thing of online training sections. Okay. Those are starting and beginning to roll out. One of the things we're trying to do as quickly as possible to train men and deploy them to be embedded with the private facility first and roll it out. So the training has begun. It has to be accelerated to be able to have those 1,000 persons trained and then raise their index of suspicion. That's going to be the critical thing, that once the person presents with fever, respiratory distress or coughing, think COVID. We should say before we last but now think COVID. And once you think COVID, you are the potential barrier, have the person put aside to a triage. The team has also gone ahead to do assessment for RPC, knowing how many places are ready. So that's infection prevention and control. Okay. That includes the triage. But there's something as the minister said I want to add. The reason why they practice social distancing is that this disease is unique in 2 ways. We call it pre-symptomatic transmission and asymptomatic transmission. What they have clearly established that before someone shows symptoms, the fever and the coughing, they are already been spreading the virus for up to 3 days before they can present. That we call pre-symptomatic. The asymptomatic is that they get people that will be healthy and walking around, showing we may never ever show symptoms, but they are still spreading. I don't know you, you don't know me, nobody know anybody. So the only effective way you can do that is practice social distancing. If you have to stay home, stay home. That's what other countries have done. All our countries are small in Africa, all our countries are growing. And the fundamental way that happens is to create the social distances, because you just don't know. They probably don't have fever. If you don't have a fever, for instance, from it in the street, you can tell. But you have these guys that are people that are pre-symptomatic. One of the case went out 3 days before they could show symptoms. You don't know who is who. So the key is practice social distancing, because you just may be saving your own life.
What I want to ask is about treatment. I remember when people started talking about chloroquine, people overdosed themselves in Nigeria. It was all over the news because people said chloroquine can build up your immune system. How are we treating those that are doing well, especially like the first 3 cases that have recovered and are now being observed in the precautionary observation centers? What are we treating them with, and what is an advice for some of us who are in the public to what do we take, what do we eat, to build up our systems?
Basically, what I started is the what they call it's just symptomatic management. Okay. If you have fever, they control the fever. And if you cough, if it's a bacterial, they treat it. And they've done very well to treat people when they have symptoms, and they do well. But the thing that is important for many persons to know, and so that everyone can come forward, is that this disease, though it is highly infectious, but it's not a fatal disease. It does not kill. 80% of the people will have mild symptoms and will resolve it. We got some of our kids that went to the treatment unit from the day they were bouncing and talking and speaking until they left. There was one that went who had difficulty in breathing, but then they got better. 80% of the people who have that mild state and will do well. 20% will get a little moderate to severe. Of that 20% will be only 5% that will go into severe respiratory distress that are required to be ventilated. And they have shown that 2 factors show that. One, age. People that are around above 60s, 70, that's a predisposition to be more severe. People that have comorbidity like hypertension and diabetic are the one that become that 5%. So you see, all 80% of the people will do well. And because it is a viral infection and we don't have a treatment now, so they will treat you for the symptom. And then the goal is to keep you alive as long as possible so your body defense system can take over. The issue of malaria, I know the minister can speak to that, because I know who has developed a protocol as a means of looking at critical cases to use chloroquine as a way of helping, because there are some evidences that have shown that she can speak to that.
Okay.
Well, according to the protocol that we got, some can use it as prophylaxis, but it can also be used as a treatment in moderate to severe cases. So there are some that we have in country, if the case management team need to use it, they will use it. But we haven't gotten to the point where we are recommending that everybody start looking for chloroquine and start swallowing it. Now, to build your immunity, you know, because you need fighting armies in your body to fight for you, so you can take your regular vitamins, you can eat vegetable, fruits, whatever it is, vitamin C, they say vitamin D. I mean, they gave you a long list of different vitamins that will help you to build your immunity. This is all that you're doing. But our advice would go out to those who have other problems. If you are diabetic, make sure that you are taking your medicine, your diabetes is under control. If you're a high blood pressure patient, don't only be swallowing herbs and drinking things and thinking that your blood pressure will be controlled. Start taking your blood pressure medicine. Make sure you are healthy every day. Eat properly. Don't drink, because we hear that people are mixing concoction of alcohol and thinking that they're killing COVID-19. You are killing yourself. You are not killing COVID-19. So don't drink a whole pile of alcohol all day, mixing gin with king juice and everything, and have a little bottle in your bag. It's not going to help you. Just make sure that you eat properly, get enough rest.
I was going to ask that question.
Rest is very important. Right now, if you don't have to go to work, stay home and rest. Don't look for what you do need to be looking for all over the place. Encourage your children to read and stay indoors as much as possible. You know, these are things that we can do for ourselves. So let's help ourselves. Eat properly. Make sure that even if you have to, and one thing that you should be doing right now, if you don't have a little potato green garden in your yard, please plant some there. You know, potato green, whatever you need to plant for yourself. Start doing some gardening for yourself, that you have fresh food to eat. So
now, what I want to ask next is health workers at this point in time, like we've seen in other countries, as soon as cases start to rise, health workers often, you know, start to ask for protective gears, or they don't get paid on time, and then they start to hold back, and then this becomes a crisis in the crisis. What is the government doing to ensure that the salaries of health workers remains constant and stable for their families as they go out there to risk their lives?
Right now, I think we are up to date in terms of payment to most of the healthcare workers, those who have NR number, because some people still don't have it. So if you don't have it, then maybe your check didn't go. But if there's any issues with anybody check out there that's a healthcare worker, it could be bank issue, it could be there's no bank in your county. Okay. So if you have any issue, make sure that you report it so we can handle it, because we do not want any kind of crisis within a crisis. Protective gears are here. We will be providing them to the different facilities to make sure that healthcare workers are protected. We'll keep orienting, because we have to keep the facility open for those normal patients that are ill. We have to keep taking care of people, pregnant women, children. They have to continue going to facilities. So we just want to make sure that we can identify those who are presenting with COVID-19 so that they don't mix with the regular patients.
Do we foresee a lockdown anytime soon? I mean, lockdown of the counties, Montserrado and Margibi counties, given those are the two counties that we've been talking about, all of these cases, you know, that have been prevalent in Montserrado and Margibi. Is there a projection of lockdown given the speed at which our cases are rising? Well,
that is not in our purview to say whether there will be or there will not be, because we don't want nobody to quote us. Or we saying that continue to follow the instructions that we are giving up to today. This is the third Sunday, so we'll look at our 21 days and review it and come back to you with either upgrading or downgrading the situation. Right now we are almost ending our 21 days, so when we end it, we will come back to everybody to say thank you for the 21 days. This is what's going to happen, and thank you again for the 21 days. This is where we are going. If any other thing will happen, you will hear it from the higher authorities.
Dr. Fala, where are we? The drive-through testing at SKD. Do we have another center, or we just maintaining SKD now where people can easily go there and get tested if they have or feel symptoms?
That's a good question. Let me go back a little. I mean, the way we can win this battle, there are two things has to happen. And the minister clearly articulated, we haven't had death in our treatment unit. Okay. You gave us a fighting chance. The public, I want to tell them to report early and on time. It's going to be critical for you to report early and on time and go to the treatment center. Stop, and this, if you think there's a history of a travel or a contact of a case that will get confirmed, right? What you do for yourself is that you call us, or you go to the treatment center. We test you. The first thing. The second thing we have done, the foundation for the control of corona around the world is testing. The reason why we're having these 13 cases is because we're looking. If we weren't looking, we're not going to find. We have done over 200 tests. Over 200 lab tests has been done. We have the capacity to do for 9,000 more, and we sit on the farm more tests to get in country. So the point about it is that the two Henny and a senior official, former official government come and say, that I don't feel right. I said, any travel history? He said no. And he said no, but I usually get international contact. I said, okay, draft through. The goal is that as the epi team, we might have to develop multiple drive-through. We might consider even mobile testing center. Those who have to come. And if we are able to get a gene expert to come, we will have to upgrade it to multiple places. Because what has been shown in countries like Korea and Taiwan, other countries associated, is massive ramp up of testing. So the drive-through is just one of several we're going to do, and we see the advantages. People will call us and say, I want to do it. Say, go and do it. And go and do a drive alone, just ensure you are taking the necessary precautions. So two things. If people can start running from one clinic to another clinic, one drugstore to another drugstore, and let us know ahead of time, we test them and remove them from the population. They have done two things. They are giving themselves a fighting chance, and they have protected this country. And we have the means to get them to a treatment center. We have the means to test them. These two working together, you can see that the other death happened either at home or facility. Even in those facilities, they presented late with respiratory distress, and they needed oxygen. Even the facility could not help them. So we know Liberian will tend to delay our treatment. But in this time, call us, let's help you to test. We'll scale up the testing. Our plan will respond as the need arises to scale up the team. Yesterday, we trained 6 testing teams. I want to go to expand the testing team massively to about 10 or 12. So anyone that needs to be tested can be tested. We tell people, if you have a home and your phone have a fence, maybe you go our guys and wear PPE, you are embarrassed, we drive in your fence. We go there discreetly in our fence, our guys wear that PPE. Our goal is to get people tested. So we're going to ramp up more teams and more places.
If you take, let's say for example, you treat yourself for malaria, and then you treat yourself for typhoid, and you're still not feeling well, drive to the testing center. Don't keep going to different labs, because the more labs you hit, the test result will not change. They will keep saying either you got typhoid or you got malaria, and you just took 10 drips or 14 or Cipro, and you're still not feeling well. Go to the testing center. Don't keep going to the different labs, because what we're finding out is that people are going to 3, 4, 5 labs to do the same test. So if you did it in one lab, 2 labs, and it's still the same, why are you going to a third lab? The test result will not change. So just drive to the testing center and check yourself.
Of course, now I'm receiving tons and tons of questions coming here and there, but I'll see if we can take 5 or 10 minutes to take few calls from the public for those of you who have questions. Now, a journalist from Banga, who's Moses Bailey, he says he's asking about the decentralization of testing centers to other hospitals like Phoebe. In most hospitals, he said, are complaining of lack of PPEs and drugs.
So we're working with the National Institutes of Health and UNICEF. There is a new kit they call the Cephate. You work with the gene expert. I was explaining that we did that with Ebola, and that made such a big difference. What a gene expert does is that you can get results in 2 hours. But it's a closed system. All you got to do, you put the specimen in the cartridge and you load it. So it reduces the chances of any infection. There are 21 sites that were used during the Ebola time, including Phoebe, that still have gene expert. What our teams have done is identify those places, and as soon as in a week's time we get the first 5,000 supply from Europe, we're going to decentralize it. We're going to, because there's a gene expert in Tapeta, there's a gene expert in Banga, there's one at GFK. So we're going to do massive decentralization. The risk is very low, and it's a closed system, easy to train the person. But this way you got to literally take the cell, break it open, extract the one we're using now for the PCR. But when we get a gene expert with the cartridge in country, about 11,000, we are going to decentralize.
Also, let me add up. Those hospitals We're not talking about small clinics in the corner. We're talking about hospitals. Any one of the government hospital that say they don't have PPE, let them call my number. They know my number. Let them call my number and tell myself that they do not have.
Have you dispatched PPEs?
They all should have some minimum supplies within their different facilities. So if they don't have, then they need to contact us. Now contact the newspaper. On top of it, we just almost getting ready to complete. Bong, Lofa, and Nimba have received the regular drug supply. Many of the counties have already received. The only ones that haven't received are the Southeast, Grand Crew, Maryland, because the truck is going to deliver. So if you are one of the counties that have not received, call me and tell me that you haven't received your drugs. But we have done our delivery of regular essential drugs to all of the other facilities except the Southeast, Maryland, Grand Crew, River G. Those places are en route to receive their drugs. So if you don't receive it, then call us and we will make sure that you receive your supplies.
And the issue of PPE, just did an assessment. One of the things from Ebola was we created a 4 logistic bases. So like there's one in Banga, there's one in Lofa, there's one in the Southeast. The last assessment we sent when we were doing the preparedness for COVID, we sent teams around. We had pretty close to 10,000, 12,000 boxes. In each of the boxes have 225, like you're saying. And then also during the Ebola, we had the MSU, the smaller unit we set in each of the hospitals. There should be PPE. If not, every hospital in this country, government hospital, has a 4 logistic base that like 4-5 hours to them. So PPE for now is not a big problem to us. The question is funny if there's a need and disability need, because we have thousands and thousands of PPE that were kept for this moment like this from the Ebola.
So they need to all work together as a team. It's not the complaints that is going to help you. It's if you don't have, you contact the proper authority, will make sure you have.
But Minister, what's the status of the 2 legislators that were quarantined on the self-isolation? I remember one of your press conferences when you were clarifying on legislators.
Those legislators are doing fine. They came through by road from Ghana, and then they are in their homes. Their quarantine should be over. The one in Nimba, his temperature has been checked constantly. They are all stable, so they should be released from the quarantine.
Okay, so for those of you who follow in and have questions, I'll just have only 10 minutes for calls. 0776 089 713, 0776 089 713, or 0880 514 096. Now, thanks to Voice of Firestone for relaying. Also, we've been relayed on Spoon TV and Spoon FM, Punch TV, as well as our own LNTV. The Voice of Firestone is relaying. The station there in River G County is relaying. The Voice of Hope in Plebo is relaying. KMTV is relaying as well. So, of course, well, and other community radio stations are also relaying this presentation. So let me take the calls now. Good morning. Okay, that person's off. Let me take this one. Good morning. Good morning, sir. What is your name?
Thank you. My name is Federal Leponapo from Okakata, Makini County.
Go ahead, please.
Yeah, let me say thank you for the minister and the doctor in studio there. One of the things I just heard from the lady there is that she distributed drugs to the area or hospital, government hospital in the county. Like for CH running in Kakata is one of the government hospital that the preferred hospital that everyone goes to take that treatment. For every time we the citizen here go to CH running, they will always ask for our own drugs or even hand glove, down to hand glove. So it's kind of already scary for me to be surprised to hear that you people distributing drugs to the various government hospital is very shocking. And then secondly, I really want to know about the testing machine, whether it is now time for people to be tested in the period where it will be shown for people to be tested. And I also want to know, my third question is I want to know where the cases occur, where people go, because out here talking about the 13 confirmed cases, so I want to know where those cases occur. Thank you.
Thank you for your question. Let me go back to the line here from the next person. Please, if someone has asked a question already, it will be important for you not to ask the same question again. Good morning.
Yeah, good morning, Daniel, and I'm on to the Minister of the Studio.
Go ahead, good afternoon, sir. Go ahead.
Yeah, thank you. Yes, sorry, good afternoon. The name is Kitashis Gavin Clement. I phoned this afternoon for mention. I think let me join the voices of all of the health workers, not just the ministers, to inform the Liberians that this thing you call Corona is here in Liberia. Let us start to place the necessary point of denial, right? We need to accept the fact that this thing is here. But ministers, I just want to perhaps give a recommendation to you too, if need be, maybe it can be implemented. That instead of the descriptive aspect start to be where you can put maybe something like a video or maybe like a big screen and start to show some of the happenings around the continent. So that people on the pass and see this, for example, people want big screen to ELW, people want to do Famuma. So that when people pass here and see the kind of thing and see how people are dying on the cases, right, of all the corona stuff around the world, I think they'll try to accept the fact that this thing is bad, it's dangerous. Thank you for the opportunity.
Thank you, sir. Thank you. Let's take the next person. Good afternoon.
Good afternoon.
Yes, sir. What is your name? Where you call from?
I'm Eric, and I'm calling from the Oro. Eric Lewis calling from the Oro.
Go ahead, sir.
I have two concerns this morning. First of all, let me say thank you to our honorables in studio and thanks for the hard work that they are doing in the interest of this country. My first concern has to do with our honorable Dr. Father. Dr. Father, you are speaking to a population where you know exactly majority of people are illiterate, even besides people who are literate. We are all not the medical experts. So will you please break down and speak in more detail so that people can understand as we are all learning about this virus? My second concern has to do with Liberia as a country. I mean, I'm watching the international news over and over and every day, looking at CNN and Al Jazeera and so on. And even people like the British Prime Minister, President Trump, is taking tests, and British Prime Minister being positive. They are announcing the names of those people. What about this country that we do not want to disclose the names of people, the communities from which the people are coming from that are being infected and dying from the virus? I mean, I think it is important that we announce the community and announce the names of these people. Because by doing that, we're going to be saving the lives of people in those very communities and other people. And we are intending to have these things scaled down. I think it is important that the public be aware of these communities and the people. Thank you very much.
Thank you, sir. So I'll take two more and then we'll come back to the guests to respond before we wrap up. Good afternoon.
Yeah, good afternoon, sir.
Go ahead, sir. What is your name?
Yes, Marco Williamade. I want to bless God for the minister so much. She met with us once and the council of judges, and she said something that I love, and I want for her to really, practice it in every center that they have. Our brothers and sisters who are going through the testing. She said during the Ebola, she had a hospital or clinic going through 21 day of fast and pray. As they will be treating our brother and sister, I would love for her to, also implement a particular system in every area that our brother and sister are, so that God can help them and be able to come out very successfully. And lastly, I want to tell her thank you because she said something. She said that now she'll be very careful the way in which they disseminate or give us information. Because yesterday, it was not easy when they brought all the information with all the family knowing. It left small for the hospital to burn. So I bless God for her and I pray that she will continue and also go about the social distancing and also encourage the church to pray more for our nation, Liberia. Thank you so much.
Thank you, sir. Thank you very much. Let me come back to Dr. Chara and Dr. Fala. Your response to the callers' concerns.
Okay. So maybe I need to go by one. Pre-symptom means before.
Okay.
So it simply means people can pass around and they'll be sharing the virus before anyone can see that they are hitting it or they get fever. But those people will surely, they will come down one day, they will show that they get the fever, they are coughing and it's hard for them to breathe. That's what they call pre, but they will show it. The aim is this is possible to be walking around looking healthy. No headache, no coughing, no fever, but at the same time they're spreading the virus. And I was saying that because the two type of way the virus spread, it is best that you try to practice social distance until you can bring the virus to the end. I will also say to the people that the better thing we can do is that if you're not sure yourself, you go and do your test. Don't go from place to place, one hospital to another place, and then when you get worse, by the time you reach now, half of you, they gotta give you oxygen, then you die. So in simple English was saying that we show that people that go to the hospital, get to our treatment place, live, and those who try to go outside don't live. So we're encouraging people, do your test. When you know your result, then you can go, and we're trying our best to get more people to be tested.
Okay, let's go back to calling names and calling communities.
Yeah.
In the beginning, we call names, we call community. There was an uproar in the country. Then we now calling names and community, we get another uproar. So what we are going to do is we are going to sit today and we are going to come up with a decision, but that decision will be made by discussion from certain group of people, and then starting tomorrow it will be either we calling names or we not calling names.
So we calling the whole thing one time.
Right. So who get, we got to do one thing or the other. So if some people will be stooning us because we calling names, then maybe we have to take the stones. Or if some people will be stooning us because we're not calling names, then we have to take the stones. So we'll come up with a conclusion by tomorrow, and we'll say whether we're calling names and communities, or we're not calling names and community. And everybody listening from all around, you will know that this decision, please do not start stooning people's houses or following people around, whatever the decision will be by tomorrow. And for those who are in Rennie Hospital, I'm for sure that they got results that they deliver their supplies. So if people are telling you there's no supplies, call. It's let your superintendent call or somebody from your community call, and we'll follow up to see why you are having issues with drugs.
Now, before we go, we initially talked about the issue with dead bodies, and you getting calls left and right now. Everybody wants you to test dead bodies. Is this something that you've started, or something that you're going to set up a system to test bodies as we go? Because some people can die, like some of the case, like the person will die or before they are tested and know that they were positive of COVID-19.
Well, I think if they call us and say this person having the symptoms, and we come, then we can do the test. But if we start testing, everybody in the country will use the tests on the bodies and not have enough tests for the living. So we have to now come up with a strategy or a system for those who can't understand. We need to come up with a system that we can bring to the public. We don't want you to be afraid. So we are studying it today, and also we'll bring it to you tomorrow, how their bodies should be managed, right?
And the best for us is that we don't want to test body. Let's all work around this time, that we don't get to that point. That people that will test, and the minister was saying, if you have the symptom, you go to the lab, you're not getting better, call all that give you the test. Call your relative, call all that kind of test your relative. That is far better than, because we know people tend to die. Every population people will die. So it will exhaust our resources.
Right. Some people will just hear coronavirus, they will die. You see, so some of the people that are dying, they even got nothing to do with coronavirus. So we don't want to count them as a coronavirus case based on the number of people that are dying.
So for the benefit of the public, can we do a rerun of where we are now, amount of cases, amount of death, just so some people who may have missed out at the beginning can get this finally?
So currently we have 13 cases. Of the 13 cases, we have 3 deaths, one of which is international. So we've done over 200 testing. We're going to ramp up our testing. Our testing results are within every 24 hours. We have the capacity to do 9,000 tests in country. We want to encourage testing more and more. When you're not feeling well and you're in doubt, drive through or call us to get tested.
Our first 3 cases, they have been discharged from the hospital, and they are in our observation center, and from there they will be going home. The other people are still in the hospital.
The reported suspected cases from Bong and Grand Gila, we tested them and they are negative.
Thank you very much. I'm sure nothing else. Thank you very much for all of you, to all of you for joining us on this presentation. Thanks to all of the relay stations, KMTV, Spoon TV, and FM, Punch TV, LNTV, the Voice of Plebo in Maryland, the station there in River G County, and all of you, Voice of Firestone, all of you who've relayed this presentation. Thanks to Dr. Jala and Dr. Fala, who always, coming here to give us the updates and taking the time out to explain and answer all of our questions. I'm Daniel Anker. I'll talk to you sometime later, but have a great day and bye-bye from Painesville.
Woo!